Neam McAvoy says, thanks for the info. I have endometriosis. I had surgery, etc., but don't want a hysterectomy. Can peptides and hormone replacement help me?
Possibly.
That's interesting. Yeah. One of the things we've been doing with this, this is a cellular stress problem. And so one of the things that I've been using is it's really the way the cell is unable to go through taking the trash out. We call it autophagy. And so one of the things we do for this is putting people on low doses of rapamycin or sirolimus. And there are some studies on using that for helping those patients. But generally, anything you can do to improve cellular stress is going to help endometriosis. Sometimes patients respond to progesterone alone. And you can do that orally if your intestines are working well, or topically if they are not. But sometimes it's a matter, it really depends on where your estrogen is, where your level is, if you're checking blood, if you're looking at that. I have patients that I just saw yesterday, her estrogen is 433. So there's very little I'm going to do that's going to bring that estrogen down. And so that patient, there's lots of things I can do. There's some herbals and some other things out, like a DIM and CDG and I3C, all those things are going to help, but I doubt I'm going to be able to get her down low enough on her own. And so sometimes we look to other things. So she was a patient that I used that in.
Did you also have an opinion on this, Dr. Erika?
Yeah, I actually agree with Dr. Turner, with Suzanne, that I have the same thing, and we do work. We do intravaginal progesterone, and sometimes it works pretty well. But I think I work a lot with DIM, and I think that it is a cellular stress issue. And I don't think you need a hysterectomy unless the uterus, there really no reason to do a hysterectomy unless the uterus is so big and your pain is so untenable. But I think that there are a lot of things you could do around it, including thyroid, adrenal support. And those are things that will help temper down. It's so funny because I had a patient yesterday with an estradiol of 500 and something. She has no symptoms whatsoever. And actually she was seeing some other doctor who was giving her estrogen and said, you could use some more estrogen. I said, no, you actually don't need any estrogen. It's like, let's let the estrogen go. So I actually had turned to her I put her on CJC and IPA and as a first line of defense. And then, the next thing with her would be BPC as far as I would do, right? And she'll do well. The other thing is Mother Nature has a way of getting those levels down anyway. You wait a little bit, they'll come down because she's perimenopausal, and that's what's going to happen when she goes into menopause. Exactly right. They'll take a nosedive, so you can wait and she'll be okay.